really need to get together and let our voices be heard.
This is Buffalo What's Next. I'm Jay Moran.
I'm Bridget Jaipal Valenza.
I'm Dave Debo.
And I'm Thomas O'Neill White.
After May 14th, how can we afford not to talk about race?
About education, about segregation, about humanity.
Since the dawn of this nation, racial violence has existed.
The way we have designed our society has a big hand in what occurred in that Tops Market.
The suburban area, everywhere. We must work and teach our children.
We need to make sure that we put more funding in our programs that help prevent gun violence and more money into art.
If we're going to have some real healing, we've got to have space to tell some uncomfortable truths.
This is Dave Debo. For this segment of the program, we're again looking at health disparities, but I think we haven't come at it this way before. Today, we're looking at the partnerships between insurance companies and all the data they have on health outcomes and the people on the grounds doing outreach in the communities. With that in mind, we have one representative from each side of that sort of description. Reverend George Nicholas just received a national award for some of his work with the African American Health Equity Task Force. He's here now with Dr. Michael Cropp, MD, the president and CEO of Independent Health. Gentlemen, thank you both for being here.
Delighted to be here.
Thank you for the invitation. It's always a pleasure to be with you.
I know, Reverend Nicholas, we've talked to you before about health disparities, but let's just start with a quick recap. What are they? How insidious are they?
Well, health disparities are really an outcome of, structural and institutional racism as it's impacted the social factors, all the things that happen outside the healthcare system in terms of the social determinants of health, where you live, the education that your children may get, the income, the wealth that you may have, your interaction with the criminal justice system. And here in Western New York, and particularly in the African American community, we have some really unacceptable health outcomes to the point where if you are African American and you live in a certain community, that you will have a greater prevalence for having chronic disease like diabetes, hypertension, heart disease, and even a shorter length of life.
You've been talking about this for a while. Yeah. The shooting on May 14th certainly, I think, brought a lot of attention to issues of racial equity. But how long have you been involved in this work?
Wow, that's a great question. Most of my professional life, right, and as a clergy member, and even before I was a member of the clergy, I used to be the lead at the Geneva B. Scruggs Community Health Center. I've done work with the United Way and all different things, and always around the issues of equity and helping those who I have been, left out of the system. And then when I went into ministry full time in I think the year 2000 or 1999 or so, I committed to working in the urban setting and really bringing together the work of the church and the work of serving the community. So I've been at this for a few years. Yeah,
just a couple.
Yeah,
and that's kind of the reason I wanted to get your history, because you have recently received a national honor for this particular work. It came to you in part because of the intervention of our other guest here, Dr. Michael Cropp, the CEO of Independent Health. Talk about the award that George has won and why you felt, because you were the one that nominated him, why you felt that he should have gotten it.
So the award, Pastor Nicholas' most well-deserved award was the Bernard Tyson Award for Health Equity. Now, Bernard Tyson was the pioneering CEO of Kaiser Permanente, who unfortunately passed away about 4 years ago now, but has left an incredible legacy. Not just in his organization at Kaiser Permanente, but through an organization that Kaiser was a member of. We at Independent Health are members of the Alliance of Community Health Plans. And so his reach was broad and deep across the country. And to honor him, that we've created an annual award given by the Alliance of Community Health Plans. And the work that Pastor Nicholas has done for many, many years, but particularly the work that he did early in the pandemic to help bring necessary resources to bear in East Buffalo that made such a huge difference in reducing the obscene mortality that we were seeing in East Buffalo before the pastor's work brought about the reduction of mortality was so extraordinary that there was no contest. When I nominated him, that nationally he was the individual who stood out.
I think those of us in the media get criticized sometimes for being too negative, and it intrigues me to hear you say that, in large part perhaps because of Reverend Nicholas here, there has been progress. Talk about the reduction in mortality.
Well, Pastor Nicholas can talk, I think, about this.
I didn't want him to be immodest, but if you're willing to be immodest.
I mean, so what happened, during the beginning of the COVID outbreak and when it was introduced here into Western New York, because we had done our work in terms of looking at health outcomes in the most distressed communities, most vulnerable communities, we knew that, COVID-19 would strike harder in communities where you have pre-existing conditions such as diabetes, heart disease, and asthma. And if you look at the health outcomes in the east side of Buffalo, specifically the African-American community, there's really high rates of asthma, heart disease, and diabetes. So with the introduction of COVID-19 into those communities, we knew that those communities were going to be extremely vulnerable. And so through the work with Dr. Raul Vasquez at GBON, one of our colleagues from Kaiser Pointer, and some other leaders within the community, we helped develop what we call the COVID-19 response team. It was funded by Erie County, and we were able to set up call response centers where we literally called everybody in the community, and then those who did not have phones, we contracted with the National Witness Project, and they went in the midst of COVID, knocking on doors and checking up on people. And we wanted to give them information about COVID. We wanted to find out if they had access to primary care. We wanted to find out if they needed food or mental health services. And also wanted to give them information because everybody just didn't know. And then as the testing became more available, we advocated for testing sites to be located in the community. As the vaccine became available, we got information out into the community about those things, and all those things working together. The call centers were embedded in about 10 churches on the east side of Buffalo and some on the west as well. And we really just did just good old-fashioned outreach, and then connecting people to where they could get services. We were delivering food to people where they needed help with mental health services. Well, we brought Best Self in and others to partner with us and be giving referrals out to where people could get mental health services. And the data shows that we were able to, at the beginning of the pandemic, about 33% of the early deaths were out of the African-American community, whereas we're only 12% of the county population. And then throughout the life of the project, you could see the fatalities being reduced to the point where we were able to get them right at about the level of the population.
Now, obviously, there is no vaccine for diabetes or asthma or heart disease. Mm-hmm. So a part of your research obviously was, get the vaccine, get some public education going there. But is there anything that you did during COVID that is translatable? What did you learn there that could perhaps apply to the broader health disparities that we've been talking about in the context of?
Well, I think one of the best learnings is the importance of community engagement, and for government and the private sector to invest in community, right, and to engage the community as a partner in dealing with public health and the public health crisis. And I think, Dave, moving the work forward as it relates to moving towards health equity I think one of the best parts of this story is here in Western New York, we're developing the type of broad-based collaboration that crosses ethnicity, race, and sector, right? So you have, a business leader, healthcare leader, CEO of independent health partnering with a local pastor, right? And work we've been doing through the Population Health Collaborative and now with the merger with Healthy Link, we're creating tables where people who have influence and access to resources are partnering, right, with community leaders to really work on solutions, not a one-off of, independent health does great work on charity with it. They have a lot of programs that are very good, but now we're moving deeper, right? Not just the charities work, but now how do we transform communities? How do we look at the root causes that drive these health outcomes, and how do we partner for solutions? And I think that's what's really exciting.
Dr. Cropp, go ahead. Jump on in.
Yeah, I wanted to reinforce what Pastor has said, that there's a huge lesson here in terms of our ability to reach people in the community who haven't had the access and the knowledge that perhaps has disenfranchised them some, but reaching them through the community and through the trusted individuals that they know, whether it's at a church group, whether it's through the block clubs, through Urban League, other community entities that are out there, and meeting these people where they are, understanding what their needs are, and being able to bring knowledge and resources in the context of their environment to them. And it's exciting to know that this story that took place here in Buffalo, where the mortality was basically cut in half, largely by the efforts of this community workforce that was backed by, other entities, that is a huge lesson that's being taken nationally through pastors' exposure, presentations at the National Academy of Medicine and the National Forum for Prevention of Heart Disease and Stroke. That's a huge, huge story that Buffalo is front and center nationally on. And so I think for us, what's imperative is the opportunity to build on this success and to recognize, as players in the health system, to, be a little more vulnerable and recognize that, we might have some of the answers, but in order to get that last mile of connectivity into the community where it's needed, you've got to work with the community.
I don't mean you specifically, but you're the doctor in front of me. Has the healthcare system, have you not done enough outreach in the past?
Oh, absolutely. Absolutely. And some of it is not necessarily by design, but, the pastor mentioned there's, institutional racism that finds its way in unconscious biases that we have that just, it's really unfortunate that we spend so much time training clinicians around the science. And, the science is changing daily. And we don't spend enough time training clinicians about how to take the science and apply it in the context of the individuals that are going to be needing it. And training the clinicians to be able to accept the evolution of science, but to be able to continue to provide it in the context of the individuals and their needs.
It's almost as if, and this sounds so harsh, I hesitate to express it this way, but it sounds as if the doctors perhaps, if they don't need a lesson in empathy, they at least need a lesson in awareness to see problems. Is that?
Well, yeah, and I think, a lot of times now in the healthcare profession, there's a lot of pressure on doctors to see a lot of patients in short periods of time. There's not the opportunity to maybe be a little more holistic in your treatment of a patient. What do I mean? When that patient comes into the exam room, all the social challenges that patient has comes into that room with them. Right. And so the doctor is limited in doing a diagnosis on what kind of has manifested itself physically. But then all the other forces that may be driving these things, the healthcare system is not built for that doctor to kind of dig deeper into those things, or he or she may not have the expertise around this areas. So we have to figure out a way when, there's a reason why, African Americans have such high rates of diabetes and hypertension and heart disease and asthma and all these other things. And we need to begin to identify what those reasons are in the social context, and then be able to develop policies and look at how dollars are being invested to begin to start address those needs. One of the big things is housing. And,
but wait a second. Housing is not a medical issue.
Well,
rhetorically.
Yeah. I mean, so we know that, if you read Dr. Henry Taylor's report, The Harder We Run, it talks about just the high rates of substandard housing in these very same communities where you have these disproportionate rates of these chronic diseases. So there is, whether it relates to just proper ventilation or all these other things that go on into having a healthy house, right? That impacts, right, your health. And so all these other social factors that drive, one of the things that was exposed after the May 14th massacre was the fact that many people in these communities with these high rates of chronic diseases don't have access to healthy food, right? And when the one supermarket that served a large part of that community was shuttered, it created access to healthy food crisis, right? Where you had to bring people from the outside to literally, set up places to give away food. That's a structural issue. That's a systemic issue. And so when these patients come in, the doctor, all these dynamics, with maternal health, all these other things, they come in with that with those issues, right? Yeah, absolutely. And so we have to figure out a way to begin to set up systems where we can address those things. So, and one of the things that concerns me is oftentimes in our responses to these high rates of diseases and high rates of issues and problems is that we want to build bigger service systems and I'm not certain that's what we want to do. I think we want to address some of the root causes so that we don't have to have, as many quote unquote services for concentrated in one community, where we can begin to start investing dollars in addressing some of those root causes so that the manifestation of these chronic diseases won't be so prevalent.
Just so I understand, when you say we don't need more services, you're talking about layers and bureaucracy. You're not declining the need perhaps for another provider or another community.
No. When I say those services, I'm talking about just planning. So, for example, if you're projecting, right, you're going to have an X amount of people that are going to need food 20 years from now. The answer isn't to build a bigger system to give out food to people who don't have food. The answer is to figure out what is driving that projection. You know what I mean?
Right. Yeah.
You know what I mean? So you want to be able, you have to meet people's immediate needs. So I'm not saying that, but to say that, the only solution to these disparities, to these inequalities, right, is develop services to address those who have been victimized by these inequalities, as opposed to investing dollars into finding structural solutions, right?
Yeah.
So that you won't have as many people in in the food line or the bread line, as some of call it, or you won't have so many people that need all these support systems. Whereas if they would just have an opportunity to build the kind of lives that they would like for themselves and their families, I think that we got to think more strategic about, bringing equity. Not only, you can't have health equity and have inequalities in education, inequalities in income, inequalities in air and water quality in certain communities. That doesn't matter what you do inside the healthcare system, you'll never be able to bring that kind of equity unless you introduce these other factors and then begin to intentionally do things to bring equity into the community. And that's why this partnership, with community and corporate is essential in getting to the solutions.
You've given me a great segue, too. Part of the reason why I think it was valuable to have Dr. Cropp here is you are the CEO of Independent Health. Insurance groups like yours have a lot of data. Reverend Nicholas was just talking a little bit about planning.
Yeah.
I'm betting that there's a connection here between planning and data.
Absolutely. There's been some public airing of issues around one specific example of health disparity, and that is the incidence of asthma on the west side of Buffalo that was particularly acute when the trucks waiting to go into Canada
were this bridge.
Right there. And, idling, and the fumes, were bringing this about. And so here you've got an example of a specific cause in a specific geography and some structural change that needed to come about in order to take that disparity and move it away. It's interesting. That was a very significant population-based look at the data. And a pulmonary physician at Buffalo General spearheaded that effort. At the same time he was looking broadly at that, he came to me with a specific case that was equally interesting and probably more under the radar. And that was a patient of his who had some chronic lung problems and had been admitted to the hospital over 100 times the prior year. And he went actually out to the home and did a home visit and found out that she was cooking with natural gas. And the natural gas stove was throwing off irritants to the lung. And so he managed to buy her an air filter and put it in the kitchen. And the next year, she had 2 hospitalizations.
Wow.
And so how often is that repeated around the community?
Tell me a little bit more about data, because in past programs here, I've had other doctors on, Dr. Willie Underwood, who's involved heavily locally with the health equity work. And he sketched out something very interesting for me that said, basically, the government is in a great position to incentivize health equity because they measure so much stuff, because there is so much data on outcomes and data on equity. Certainly is something that the CMS has at their disposal. I'm betting that same level of data intensity, to a degree, is a factor at a place like Independent Health.
It is. And I think that there's a level of maturity about looking at the data around health equity that's advancing quite rapidly. And one of the things that I think we're beginning to understand is that an investment in health equity creates a positive economic return for the community.
Okay.
And if you look at what we see in terms of the costs of poor health, and these are both medical costs and lost productivity in the workplace, that those costs are huge. And our ability to close the gap and bring down the rates of hypertension, the rates of diabetes, the chronic diseases that follow on from that, end up in, and perhaps the hospitals aren't excited about this in the current economic model, but less hospitalizations.
Right.
Less of those significant events that are expensive and traumatic to individuals. But more importantly, our ability to close the gaps on poor health enables people to be more productive at work, to keep that job, to have the economic resources that Pastor Nicholas was talking about, to be able to eat better, to be able to address the housing issues. And so I'm really excited now about the government catching up with some of the private economic analyses that have been going on to demonstrate that an investment in health equity really does create a positive economic return for an organization like Independent Health, but more importantly, for the broader community.
Yes. Can the government look at all the big pots of data they have, or even that you have, and say, oh, gee, outcomes in this particular zip code are bad, and use that kind of as a carrot and a stick? Incentivize better outcomes by analyzing the data they have on where these outcomes are not ideal.
Absolutely. And if the government were really going to take advantage of this opportunity, they would do what Dr. Underwood suggested, and that is put some incentives into what's coming out of CMS through the states to localities, so that if every locality is starting with a certain baseline in terms of their inequities, and that information is readily available, right, through public data, start to reward those communities that have figured out how to work together like Buffalo is working together to close those gaps, and more money should be flowing to those communities that have built the processes to have that kind of collaboration with demonstrable gap closures, instead of just good money after bad, as how the current funds flow from the federal government through the states to localities.
Give me a little bit of Insurance 101. Are you under that same sort of outcome pressure where statistics determine funding?
Yes, we are. Our government programs, the amount of money that we get from the federal government directly for Medicare and from the state for Medicaid is somewhat dependent upon the quality of the results that we deliver. And going forward, there is the incorporation of health equity metrics into that. But I want to take that one step further in terms of the federal government actually putting more money in play to flow through to the states, which would then flow through to the localities, because our ability as a community to close the gap is going to be dependent upon not just Independent Health. It's going to be dependent upon the community work. It's going to be dependent upon the other insurers and the health systems. And so more money that comes through collectively to the community, I think, is what should be rewarded in terms of the kind of effort that's been built in this community to move the ball further down the field.
Reverend Nicholas, you're shaking your head. Go.
No, you're absolutely right. I mean, we have to look at what are the drivers of poor health outcomes, and then what are the solutions, right? And fund those things. So if we, if we do an assessment of a patient, of an individual, and we find that, well, their housing is inadequate, or their son or daughter is, really struggling in school, or if the, air and water quality in their home is not good, or whatever those things are, then we need to be able to put something in place to address them. And there are enough resources in order to do that. It's just that we have not prioritized these things, and we haven't taken the time to kind of build the kind of system that would address those things. I think in other countries, they invest healthcare dollars into prevention stuff at a much higher rate than we do in this country. So we have to, for a simple example, when you say, exercise is important, right? Well, the places like the Planet Fitnesses and all that, those are all in the suburbs.
Yeah.
right? You don't see that something like that on the east side.
Wait, you do.
Which
the medically oriented gym that Jericho Road built.
Right. Okay. There's one. Yeah, but but the big
commercial scenes are not there. Yeah,
people in there, right? And that's a good point. Yeah, I've seen it. It's a nice place.
It's really nice.
But we need to figure out. We have lots of vacant spaces and stuff.
Yeah.
Can we have robust? I call them wellness centers, right? Where they're facilities where people can actively engage in things that will have a positive impact upon their health, and figure out a way to fund this stuff.
But I want to shift gears a bit, because some of the systemic changes that are needed around issues of housing are bigger than just healthcare, as you indicated. Yeah. But one thing that we're seeing is the impact of food insecurity. Mm-hmm. And whether it's in East Buffalo or West Buffalo or out in South Wales, this is not something that is just unique to a specific geography. In our Western New York community, we're seeing the impact of that. And as you noted earlier, poor nutrition is going to lead to diabetes. It's going to lead to high blood pressure. It's going to lead to these chronic diseases that we saw. So we are really blessed in our community that there is a tremendous amount of grassroots work going on now to address food insecurity. And getting that right is something that I think is within the reach of the health plan to help, within the reach of community resources like Pastor Nicholas.
Sure.
And some of these startup organizations like Alex Wright with his African Heritage Food Co-op. So, we got permission from New York State to start this new program,
right,
where most of our folks who have Medicaid qualify for SNAP benefits, the old food stamps.
Yeah.
A certain percentage don't. We're working to get those on the SNAP benefits. But in working with Alex and working with another partner that we have called Food Smart, we are able to provide meal planning and food delivery services and using the SNAP benefits to be able to now move forward in helping to close the gap on the food insecurity challenge. And I think
the first cohort, I think they were able to reduce it by 30% for the group. Yeah.
Yeah. And so there is, I think, some very valuable data for us to be able to look broadly and see where are the opportunities that we can understand there's a gap, recognize that there's some community resources ready to be deployed, and do the last pieces to put them together to make that difference.
Yeah. And again, it's all about partnership. I mean, that's the key. It's time out for, corporate America having its plan. Government wants to do it one way. The community people are saying it needs to be done this way. It hasn't worked. And we have to create spaces and create tables where we can have conversations across these sectors and across race and really begin to have practical, realistic, but effective solutions to a lot of these issues, and then do planning. So we have a First Fruits food pantry at our church, and we feed every Tuesday and Saturday. So we can do that, the immediate thing, while working on the bigger structural things. How do we get greater access? Because one of the things they say, people ought to eat healthy, fresh fruits and vegetables, right? But what if you don't have a venue in your community to do that? And then when you look at the massive poverty that's in a lot of communities, one of the ironies in life is unhealthy food is cheaper than healthy food, right? So if you're on a limited budget, we know you can go and get ramen noodles or something, which is high in sodium, right? Yeah. But you can buy that
potato chips, whatever, right?
And so we got to figure out ways in which we not only create access to healthy food in poor communities, but we also have to figure out ways, how do we impact income, right? So that people have the resources to buy those healthy foods for their families.
And you just, when you talked about income, you just broadened the discussion big time.
Yeah.
We've got to develop ways in your mind of having people earn more.
Absolutely. I mean, again, we can't. One of the things that, in my conversations with people in the healthcare profession, when you do a diagnosis of a person, right, and let's say you diagnose 5 things that makes driving the sickness, you can't just say, well, we'll deal with these 3. These other 2, well, you know what I mean? You got to figure out, okay, if we understand what's driving these poor health outcomes, whatever they may be, right? We can't ignore any of them. We got to figure out how we can address those things.
Guy comes into the ER with a hangnail and also a broken bone. You don't just look at the hangnail.
Well, yeah. I mean, if it's easier for you, you do.
Okay.
Right.
Okay. Yeah. You know what you're saying. Right.
If you're not really concerned about that person's condition, you do. Right. But if you're really, if you're really empathetic and look at that person as a human being, and you really want to meet his needs, then you have to look at the totality of what's ailing him. And I think we have not done this as a society around these issues of health equity. We've done things where we say, well, we just dismiss them and act like, oh, well, we just can't address that. And for me, it's impossible for me to accept that, especially when we know that, in this community, when things are important to you, like building a football stadium, we can miraculously, come up with resources, task force plans, designs, all kinds of stuff. And presto, the same community where you said that you can't find a way to make sure a single mother can feed her child, then that's just unbelievable to me. And it's something that we just do not accept. And again, it requires inclusion, it requires collaboration, and it also requires respect. Just because a person, is dealing with some challenges about where they live or where their child goes to school or whether or not they have access to transportation, doesn't mean that they should be treated less than. Just because you have less stuff does not mean that you're less human. And so whatever we do, we have to make sure that we honor and respect the people that we say we're concerned about, and honor their voices and honor their choices as well, and try to help them to address some of the many challenges they have on a day-to-day basis. So in this process, there has to be inclusion, but also respect. That's real community engagement, right? Is when you're really hearing the people that
not just there, but there to hear.
Yes.
Gotcha.
Yeah.
Gentlemen, thanks so much for being here.
Thank you, Dave.
Thank you. This has been a great conversation, and I hope that people hear this as an invitation for wherever they are to get involved in this work around health equity, because we need everybody in this battle.
The Reverend George Nicholas is a pastor at Lincoln Memorial United Methodist Church in Buffalo. He's the chair of the African American Health Equity Task Force. And Dr. Michael Cropp MD is the president and CEO of Independent Health. This is Buffalo What's Next on WBFO.
Not sure what you want to watch tonight? We've got you covered. Visit WNED.org/TV schedule to see what's on WNED PBS, WNED Create, and WNED PBS Kids. Click the Primetime button to see what's on tonight. You can also search for your favorite programs in the search bar, or look for programs by date and time. Visit WNED.org/TV schedule and start making your viewing plans now.
Watch the WNED PBS original production, Garden Wisdom, for Western New York and Southern Ontario. Learn the secrets to planning, cultivating, and nurturing your own extraordinary garden using time-proven solutions and sustainable methods. Garden Wisdom, now streaming on YouTube and the PBS video app.
Get all the trusted local news you need right to your inbox each weekday morning with the WBFO Daily Email. Visit WBFO.org to sign up today.
Listen to Buffalo What's Next weekday mornings at 10 a.m. on WBFO or on the WBFO app. Use the Talk to Us feature to leave your questions and comments.
This is Buffalo What's Next, where we have conversations with the community about moving forward. To have your voice heard, press the Talk to Us button on the WBFO app, and we'll work to get your questions and comments on the air. Join us on Twitter at WBFO or email us at news@wbfo.org. Together, we'll have the conversations that are needed. This is WBFO, your NPR station.
This is Dave Debo. After the top shooting, there were several efforts to make sure that school kids have access to a diverse collection of books on things like African American history and other related topics about diversity or equality or equity. Most notably, thousands of books were donated by those who responded to an appeal from shooting victim Zaire Goodman. But another one of those efforts is more recent, and it involves a collection of books at the Merriweather Library on Jefferson Avenue, almost right across from the shooting scene. The collection is also at the Central Buffalo Library downtown and at the Butler Library on the SUNY Buffalo State campus. This collection is a little different. It was curated by Project Flight, a local literacy nonprofit. Professor Geraldine Bard is with us from that group. Buffalo and Erie County Public Library Director John Spears is also here, and the two of them are obviously connected to any sort of project involving books. But this particular collection actually got its start with students at St. Joseph's Collegiate Institute, and senior Dion Anderson is here now, too. Dion, let's start with you. Student at St. Joseph's Collegiate Institute, and you just suddenly had this idea, or the club, the Equity Club, had this idea that there wasn't enough materials out there for kids that explain racial equity. Was that, in a nutshell, the way it started?
Yeah, it was our moderator, Miss Golden. She kind of brought up the idea, and she felt like that we needed more equity and social justice in the city of Buffalo.
But specifically not just in the city of Buffalo, but you're talking about equity in the amount of reading materials that are available out there.
Yeah.
What does that mean? Explain to me why you felt that was necessary.
We feel like equity and social justice is a real topic that needs to be educated more in Buffalo for kids. You know, I honestly didn't know what it was when I was a kid, so I feel like us giving out books to the library to kids will actually educate them more on what needs to be known about people who look like me.
What do you think the average person doesn't understand about people who look like you? What do people need to know?
People need to know how we are treated, kind of, how fair life should be between everyone in the world, basically.
And I'm sure that a lot of your impetus for this came, no doubt, because of the shootings on 5/14.
Yeah.
How did that impact you? Can you talk a little bit about that? Are you comfortable going there?
Yeah. Me personally, or as St. Joe's?
You, and then we'll talk about St. Joe's.
I mean, I didn't have any relatives or anybody that I really, really knew who passed away, but I knew the security guard that passed away a little bit. I didn't know him personally, but it really affected me because it was in my neighborhood. So when things like that happen in my type of neighborhood, I don't feel safe anymore. So I feel like I couldn't go anywhere because there was rumors going around. There were still people out there who were trying to go to very populated places where there would be a lot of people who look like me at, and just target people who look like me.
And is the theory that if more kids read books like this, that perhaps there will be less people who grab a gun and become like the shooter?
Yeah.
Do you think that'll happen?
I mean, not everyone thinks the same, so I honestly can't speak for everyone, but I feel like the right people will make the right decisions.
All right, now take me through the rest of the process. So you and other students and your advisors say, we need these books. What happened after that?
So Ms. Golden, she wanted to kind of get equity and social justice out there. So the way we thought of it was she brought up a charity. So we had a dress down day. We made a petition to our principal, Mr. Spillman, and we said that we want to host a dress down day to raise money for a library that was in the same community as the top shooting. So the Maston community, basically. And we had a dress down day, and she sent the email out to the students explaining what Project Flight was and how we're going to work with Project Flight in the library with the Merriweather Library. and we asked the students, each student in the school, to donate $5, and that's how we came up to about $2,000 to buy the 111 books for the students. For the kids, sorry.
111 books. That's huge. That's a lot more than I would have thought you were able to do. Let's bring in Project Flight then. Let's talk a little bit more about that. Dr. Geraldine Bard is with Project Flight. Thanks for stopping by.
Thank you, Dave. Thank you for the opportunity to talk about this initiative. I'm standing in for Dr. Betty Capella, co-director of Project Flight. With me, this project was envisioned by her, and the synergy of St. Joe's students and the Buffalo and Erie County Public Library and Project Flight demonstrates that we're a community of individuals who care about humanitarian leadership. And certainly the students at St. Joe's and the Buffalo and Erie County Library really are the cement that help us all hold the bricks of the community together.
Tell me a little bit more about what Project Flight does beyond this project. Who are they?
Well, we've been in existence since 1994. We've worked with, as founding partners, the Buffalo News, WGRZ, and of course the Buffalo and Erie County Public Library, Wegmans, to bring together an opportunity for those in need in our community. And of course, in our community, students at risk, number 3 or number 4 in students at risk throughout the United States for cities our size. We have children who are living in homes with parents and caregivers who must make a decision to buy a bottle of milk or to purchase a book for their children. We know they will purchase milk and bread before a book. So how do we get books into the hands of these children? Our motto is, of course, that every child must have a book, read it at grade level, because we truly believe that literacy is an entree out of poverty. And we've worked since 1994 with our partners. And of course, United Way has been a major partner. Bob Bennett was part of our founding group that...
Bob used to be the CEO of the United Way. Before that, he was on the Board of Regents.
Absolutely.
And did a lot of work with early childhood education. The Success by 6 movement, I think he was
absolutely
a champion of.
Absolutely.
The idea that if you give kids fundamentals early in life, it certainly helps them down the road.
Absolutely. And the United Way has through the years always been at the forefront of such success with children.
But the purpose of the initiative here isn't just to bring books, but to bring more socially or culturally appropriate materials in, right?
The purpose of this collection is, first of all, we were personally devastated by the violence that occurred on May 14th, right down the street from the Merriweather Library on Jefferson Avenue here in Buffalo. Our neighbors, our community suffered a tragedy, and linked with St. Joe's, linked with the Buffalo and Erie County Public Library, we were determined to establish a program that could help us heal. These books that we've developed help develop empathy, build a shared background knowledge that highlights the simple power of kind deeds, advocacy that helps others thrive. We believe that learning effective strategies is violence prevention.
Let me back up and ask you about that. To what degree do you feel these specific books were needed? What kind of impact might they have down the road?
Okay, well, for example, we have biographies in this collection. Martin Luther King, Dr. Martin Luther King, Salam Aleikum, Desmond Tutu, Mahatma Gandhi. When we read about their lives and dedication to peace and the betterment of humanity, this serves as inspiration and serves to reinforce Dr. King's hope that his and all people's children should be judged by the content of their character, not by any other standard. We believe that all people can be given the same opportunities to pursue life liberty, happiness, and peace. We have other books that offer strategies which can be implemented to ensure peace. For example, one of the books we've placed, not a biography now, a strategy book, Keeping the Peace, a kid's book of peacemaking by Hanson Anders. It teaches children how to solve conflicts by finding out first what each person wants and ending with a solution. Another book, Why Do We Fight? Conflict, War, and Peace by Nikki Walker Battles. We look at protests, we look at standoffs, we look at strikes, we hear about them. The book is designed to have students understand that one way, violence resolves the conflicts. The other uses signs and picket lines.
And overall, there are...
Both start with disagreement, and now how can we take that disagreement with communication, with understanding, and choose peace
and
as opposed to violence.
In this collection, there are 92 books. You and Dr. Capella curated them?
Essentially 111.
Really? That many? Okay.
Yes. And again, they're divided between biography and these self-help books. Just one more, which is one of my favorite. We hear so much about bullying. Say No to Bullying by Louise Spilsbury and it covers the basics of bullying, talks about reasons why people behave badly, and it provides guidance for how to deal with bullies, both personally and on behalf of others.
Are you pleased, Dion, with the selection?
Oh, yeah, definitely.
Tell me why.
I feel like this will really explain to the kids in the master community about what's really going on in life and how they should deal with life in the future.
All right. Let's now bring in John Spears, the director of the Buffalo and Erie County Public Library.
Thank you.
Thanks for stopping by. Does this collection make a difference when we look at it in the context of all the other books that the library has?
I think it does, and there's a few reasons for that. One, this collection is highlighted. This is a collection that's pulled out, that there's community involvement in the creation of it.
In part, that's why I asked. You probably have a biography or two of Martin Luther King. You probably have a book or two about Mahatma Gandhi. But this is different.
We do. A lot of the titles we already owned, and they were kind of scattered over our 37 locations. But this is really bringing with intentionality, a collection to the Merriweather Library that is going to, as Dr. Bart explained, it's going to give some wonderful information on how you can overcome conflict, how you can battle violence. But then those biographies, I think on the East Side, anytime you have a biography of Martin Luther King or of Mahatma Gandhi, it is showing people their own people. And that is, I don't think that can be underestimated, the value of that. Just seeing yourself reflected in a library's collection makes the library relevant to you. 30 years ago, that wasn't necessarily the case.
And so this collection is at the Merriweather on Jefferson, almost right across the street from the shooting scene.
Yes.
Then there's also the same collection at Buffalo State and the Butler Library, and one at the main library downtown.
Yes, we're still building those out. They're going to be the same materials, but the library staff has purchased the materials, processed them, cataloged them, and then we'll be adding the collection at Central, and then we'll be giving those books to Buffalo State for their library.
Do you think it'll make a difference? At some